Today I'm going to teach you about the 5 most common forms of depression and what we can do to overcome them. We will learn about the following 5 types. Number 1, major depressive disorder. Number 2, persistent depressive disorder, otherwise known as dysthymia. Number 3, disruptive mood dysregulation disorder. Number 4, premenstrual dysphoric disorder, or PMDD. And number 5, postpartum depression. If you're watching this video, you most likely know what depression is, but precisely it's a mental illness that is characterized by having a depressed mood most days and a lack of interest or pleasure in all or almost all of our activities. It can affect our appetite, sleep, and many other areas of our life. It's also incredibly common, affecting more than 280 million people in the world. So even though we can sometimes feel isolated and alone, know that you are not alone in what you're going through. The first form of depression I want to talk about is major depressive disorder, or MDD, because this is what mental health professionals mean when they say that we have depression. MDD is diagnosed if we have 5 or more of the following 9 symptoms in the same 2-week period. And at least one of these symptoms must be either depressed mood, feeling sad, hopeless, or empty, or loss of interest or pleasure, what we call anhedonia. Now moving through the rest, right? That was the first 2, has to be one or the other. We must have 5 total out of these 9, okay? Hang with me. So the third possible symptom is appetite disturbance, meaning we could lose or gain weight due to our depression. Fourth is sleep disturbance, which could mean that we're sleeping more or less than normal, depending on how our depression affects us. And in my experience, this is usually shown by us feeling tired all day, and then when we lay down to actually go to sleep, we can't. And instead, we ruminate about all the things we've done that are stupid or didn't go well in our life. It's super fun, said no one. But moving right along to the 5th possible symptom is psychomotor agitation or retardation, which is just a fancy way of saying that we can feel restless a lot, or on the other side, we feel like we can't move as fast as we want to, kind of like there's a weight on us or something holding us back. And just like with appetite and sleep, it can kind of go either way depending on how our depression affects us. Number 6 is feeling fatigued or having a lack of energy nearly every day. Number 7 is feeling worthless or having excessive or inappropriate guilt every day. Now, this symptom tends to be another incredibly common one, and you can kind of see how all of these symptoms link together. Like if I'm staying up late at night thinking through all the dumb shit I've done in my life, that can start to make me feel worthless and guilty about things that maybe I didn't even have control over, which then in turn can leave me feeling sad and hopeless. So you can kind of see how they all tie together. But okay, let's move on to the last 2 possible symptoms. Symptom number 8 is having a diminished ability to concentrate, which is why when we are depressed, we can struggle to remember what we watched or read, and it can make work or school incredibly difficult. This symptom isn't talked about as much as I think it should be. But anyways, the final possible symptom is number 9, having recurrent thoughts of death, suicidal thoughts, a plan, or attempts can also accompany a diagnosis of major depressive disorder. MDD can also be part of bipolar disorder. When people talk about bipolar depression, what they mean is that as part of our bipolar 1 or 2 diagnosis, we also have depressive episodes that happen either before or after our highs of hypomanic or manic. And the symptoms are the same, it just isn't MDD if we also have the highs of hypomania or mania. Does that make sense? Also, one important differentiation needs to be made between depression and grief. Grief can have some of the same symptoms of depression. However, grief lessens over time in its severity, and it comes back in waves when we have an anniversary or see or do something that reminds us of who we've lost. Depression doesn't come and go. It's palpable for most of the day, nearly every day. Let's move on to the second type of depression, and that is persistent depressive disorder, or dysthymia. When the DSM-5 came out in 2013, and yes, I know the DSM-5 text revision just came out too. Everybody's excited. But when the DSM-5 came out, they merged the 2 old diagnoses of dysthymia and chronic major depressive disorder. And they gave it kind of a new name, although you can also still call it dysthymia too for some reason. I'm not really sure. But PDD is when we have a depressed mood for most of the day, for more days than not, for at least 2 years. I know. Remember, MDD requires 2 weeks. This is 2 years. And that is the main difference between this and MDD. But along with having a depressed mood, we also only need 2 of the following 6 symptoms. And those possible symptoms are, number 1, appetite disturbance. Number 2, sleep disturbance. Number 3, low energy or fatigue. Number 4, low self-esteem. Number 5, poor concentration or difficulty making decisions. And number 6, feelings of hopelessness. All in all, PDD is a lower grade depression that lasts for much longer. When we are suffering from this, we can forget what it was actually like to feel happy, or at least not feel depressed. And that can prevent us from reaching out for help or even speaking up about what's going on, especially if we started feeling this way when we were young. And also note that in children, these symptoms must last for 1 year, not 2, in order to be diagnosed as having PDD. And research shows that in most cases, those of us with PDD did start to feel this way when we were young. And since it can lead to other mental health issues like personality disorders or substance abuse, it's important that we reach out and get the help we need and deserve. You can feel better. Sometimes we just need some professional help to get us there. The third depressive disorder I want to talk about is disruptive mood dysregulation disorder, or what we're going to call DMDD. This diagnosis was added to the DSM-5 as a way of preventing the overdiagnosis and treatment of bipolar disorder in children. So it's a newer diagnosis, and I'm going to be honest, I think it still needs some sorting out, but let's get into it. The primary symptom of DMDD is chronic and persistent irritability. And while many people experience irritability as part of their depression, this is a bit more than that. For starters, this is a childhood diagnosis where we must meet the criteria, whether that's through history, meaning we knew it happened back then, or current observation. So we have to meet all this before we're 10 years old. Along with that, we must have, number 1, severe recurrent temper outbursts, which manifest verbally and or behaviorally, meaning we go into verbal rages or show physical aggression towards others. And these outbursts are grossly out of proportion in the intensity and duration to the situation or provocation. And number 2, so second symptom, the outbursts must be inconsistent with our developmental level, meaning the way we're reacting isn't really, normal for someone our age. And number 3, all of these things must occur on average 3 or more times per week. Number 4, our mood in between these temper outbursts is still irritable or angry most of the day, nearly every day. Number 5, those 4 symptoms I just talked about have to have been present for at least a year. And during that time, we haven't had 3 or more months without them. And finally, number 6, those symptoms are happening in at least 2 out of 3 settings. Like out of home, school, and with friends, it's happening at home and school. And these symptoms are severe in at least 1 of those settings. Also, we cannot be diagnosed with this before the age of 6 or after the age of 18. And we can be diagnosed as having had this when we were a child, meaning that we could get the diagnosis after the fact when we are already an adult, but it can't be noticed in an adult and diagnosed as only happening in adulthood, if that makes sense. They aren't sure if this diagnosis only exists in this age-limited fashion, which is why the DSM kind of sucks sometimes, but it does state that it shouldn't be diagnosed after the age of 18. And it doesn't make sense to me that we would just grow out of this, especially since it's a depressive disorder. But the DSM does state that we will most likely develop MDD or an anxiety disorder in adulthood, not bipolar disorder, which I guess they believed was being overdiagnosed and treated in children. Either way, it's important to know that if we are feeling extremely irritable all day, most of our days, there is a name for what's going on. and there is help available, so please reach out and speak up. The fourth form of depression is premenstrual dysphoric disorder, or PMDD. While PMS can have emotional and physical symptoms as well, PMDD is a much more severe and debilitating extension of PMS. It is diagnosed when we have one or more of the following symptoms. Number 1, mood swings, like suddenly feeling sad or tearful, or increased sensitivity to rejection. Number 2, noticeable irritability or anger, or increased interpersonal conflict. Number 3, we have a depressed mood, feelings of hopelessness, or self-deprecating thoughts. And number 4, marked anxiety, tension, and or feelings of being keyed up or on edge. And we must also have one or more of the following 7 symptoms as well. And the first possible symptom is, number 1, decreased interest in usual activities, kind of like the lack of interest or anhedonia that we see in MDD. Number 2, difficulty concentrating, again, just like we saw in MDD. Number 3, lethargy or feeling easily fatigued. Number 4, changes in appetite, overeating or having specific food cravings. Number 5, sleep disturbance. Number 6, a sense of being overwhelmed or out of control. I mean, who doesn't feel that way sometimes, right? And number 7, physical symptoms such as breast tenderness or swelling, joint or muscle pain, feeling bloated, or experiencing weight gain. And between that list and the previous one, we must have a total of at least 5 symptoms. And the symptoms that we must have to obviously, like all diagnoses, they have to cause clinically significant distress or interference with work, school, social activities, or relationships with others. And now this is important. In the majority of our menstrual cycles, at least 5 of these symptoms must be present in the final week before we have our period and start to improve within a few days after our period starts, and then become minimal or absent in the week after our period ends. All in all, if we have PMDD, we feel like shit for most of the month, but we have about a week, maybe 2 if we're lucky, where it's not that bad. So if anyone ever tries to minimize our PMDD, or if you even struggle to accept that it's affecting you in your life, maybe just rewatch this portion of the video and allow yourself to really hear the symptoms, because PMDD is terrible, it's uncomfortable, and it deserves proper treatment and care. The final form of depression I'm going to address today is postpartum depression. And this is when we develop MDD after having a baby. Although the American Psychiatric Association calls all depression during or after pregnancy peripartum depression. They state that they made this change because much of postpartum depression occurs before the baby is actually born, and they don't want pregnant people to put off getting help because of when they experience the symptoms. Pregnant people are more vulnerable to depression because pregnancy and childbirth affects our hormones, can impact our career, our financial situation, and pretty much everything we have going on in our life. And while many of the symptoms are similar to those of MDD, there is this added issue of connection with our child. And those with peripartum can struggle to feel that connection. And some people can even develop postpartum psychosis. About 1 to 2 people in every 1,000 deliveries will struggle with this, which can make us a danger to our child or even to ourselves, which is why it's incredibly important to speak up. If you aren't feeling or thinking like yourself during or after your pregnancy, talk to somebody. Not to mention that peripartum depression itself occurs in 1 out of every 7 pregnancies. Peripartum depression can happen to those of us who already have a history of depression or anxiety, but if we haven't had depression before, having peripartum can make us more likely to develop depression and or anxiety again. And also, I think it's important to know that postpartum depression can occur within a year after giving birth. It doesn't always happen right after we give birth. And finally, having what they call the, quote unquote baby blues is different from peripartum because the baby blues happen right after giving birth and only last for a few weeks. If you feel your symptoms are more severe, you're having trouble connecting with your baby, or have any thoughts of hopelessness or suicide, or thoughts of hurting your child, please reach out and speak up. It is best to get support and professional help early on so that you can be the best parent to your newborn baby. Since we are already talking about treatment, let's jump into some ways we can better manage our symptoms of depression. When it comes to any form of depression, therapy is always our first line, unless our symptoms are severe. Now, I know you may be thinking, well, what is severe? If you aren't able to participate in therapy fully, either because you can't concentrate, can't get there on time, or do any of the homework, or if you are actively suicidal, therapy alone isn't going to be enough. So stick around for a minute and I will share some other options. Now, for therapy, we want to find someone who utilizes both behavioral and thought techniques, which usually means they practice either CBT or DBT styles of therapy. These thought techniques are things like noticing our unhelpful or negative thoughts and checking the facts to see if we have any things to support that thought. Also, challenging them using bridge statements so we can move our thoughts into a more neutral, I didn't say positive, place. We could also fight back and come up with 3 to 5 things each day that went our way, because research shows us that one of the main differences between a happy and unhappy person is that a happy person looks for the good things in their life, and an unhappy person looks for the bad. So looking out into our world and seeking the good things can change our entire mood and outlook. The behavioral techniques I was talking about with regard to therapy would be things like going for a walk, getting enough sleep, smiling at a stranger, showering every day, and making sure we eat regularly, just to name a few things. But like I said, if we can't even imagine doing any of these things because we just don't have the energy or motivation, that's okay. Along with therapy, we can consider medication like an SSRI or SNRI, otherwise known as an antidepressant, or even an atypical antipsychotic like Latuda, Abilify, or any other number of options out there. Reach out to your doctor, preferably a psychiatrist because they know psychotropic medication best, and let them know what symptoms you're experiencing. Also, make sure to ask about any side effects or any other medications that you're on. And remember, it can take a few weeks for you to feel any positive effect from the medication. So do your best to be patient during this time. I know it's frustrating, but it can and will get better. Oh, and I also want to mention that there are other options aside from medication, things like vagus nerve stimulation, which you can trigger yourself. I actually have a full video about it if you want to know more. Or you can even get a stimulator implanted and let it do all the work. All in all, just make sure you ask about all of your options so that you get the treatment that is right for you. Have a great rest of your week, and I will see you next time.